heavy menstrual bleeding, also known as menorrhagia, is a very common condition that can significantly affect a woman's quality of life. Not only can it make you feel very tired and exhausted, but it can also affect your normal day-to-day activities such as going to school, work, or attending social events. And also it can be quite expensive, especially if you're spending a lot of money on your pads and tampons every month. So in this video, I'm going to be talking about how you can identify whether your periods are heavy and what can be done about it. So what is the normal amount of blood loss during a period? So everyone's period is different, but typically a period can last between 5 to 7 days. It's normally at the beginning of the period, so the first few days where it's at its heaviest, and then it becomes lighter as the period goes along. And it's actually estimated that there's roughly around 30 to 40 mils of blood loss during a normal period, which equates to roughly around 6 to 8 teaspoons of blood. So I know that can be quite difficult to estimate just by looking at your pads or tampons. So here is a rough guide of what you can use to try and estimate how much blood you're losing. So a normal pad or tampon can hold around 5 mils of blood, whereas a super pad or tampon can hold around 15 mils of blood, and a menstrual cup can hold between 15 to 30 mils of blood. So in terms of heavy bleeding, it's actually estimated that there's roughly around 80 mils or more blood loss during a period, which equates to roughly around half a cup of blood. So apart from the amount of blood you're losing, how else can you tell if your periods are heavy? So firstly, if you are having to change your pads regularly, so every hour, or you're waking up in the middle of the night to change your pads, if you're having to use double protection, so using both pads and tampons together, if you are soaking through your clothes or your bedding, that could indicate your periods are heavy, if you are passing large amounts of clots, and also if you're feeling quite tired or exhausted, that could be a sign of anemia, which can be secondary to heavy menstrual bleeding. So what are the causes of heavy menstrual bleeding? It's actually interesting to know that in about 50% of cases, which is approximately half of all cases, there isn't any identifiable cause. In other cases, there may be a cause identified. So the first thing is having fibroids. So fibroids are basically non-cancerous benign growth within the womb. And if you would like to know more about fibroids, please check out my video on this. Other things which can cause heavy bleeding include conditions affecting the uterus. So things such as endometriosis, where the lining of the womb is found outside of the womb. Other things include endometrial polyp, which is a small fleshy lump inside the lining of the womb. And certain types of cancers such as endometrial cancer or cervical cancer can cause heavy menstrual bleeding. Heavy menstrual bleeding can also be caused by a condition called pelvic inflammatory disease, also known as PID, which is caused by a sexually transmitted infection such as chlamydia or gonorrhea, which has infected the womb or the surrounding structures. So it can also be due to hormonal changes such as having polycystic ovarian syndrome and other hormonal changes such as having an underactive thyroid. Certain medication also can cause bleeding. So if you're taking blood thinning medication such as warfarin or antiplatelets such as aspirin or clopidogrel, and there are some over-the-counter or herbal remedies which can cause heavy bleeding. This includes things like aloe vera or ginseng. And then heavy bleeding can also be caused by having the intrauterine device and also having a blood clotting disorder such as von Willebrand disease. So what can be done about your heavy bleeding? The first thing is to make sure that you speak to your doctor. So your doctor will take a history from you and identify the symptoms that you're having. They may also want to do an examination, so an internal examination, which is to have a look at the neck of the womb and also to feel the size and the shape of the womb, which can indicate certain conditions. They may also want to do some investigations, so they might want to perform a vaginal swab if they think there's a risk of sexually transmitted infection. They also might order an ultrasound scan for you. So this is normally done transvaginally, where a probe is inserted through the vagina to look at the uterus and the structures, which can identify things like fibroids or polyps. And then they may refer you to the gynecologist, which are specialist doctors that can do more detailed investigations such as an endometrial biopsy if they have any suspicion that this could be something more sinister like cancer, or they may want to do a hysteroscopy where a small probe is inserted into the uterus to look for any structural changes and also to take a biopsy as well. So how do you treat heavy menstrual bleeding? So this depends on the cause. Obviously, if there's a cause such as fibroids or endometriosis, then those are managed accordingly. However, as I mentioned, in 50% of cases, no cause is identified. So the main treatment is helping to reduce the patient's symptoms and also reducing the heaviness of the bleeding. The first line treatment is the intrauterine system, also known as the menorrhagia, and that is different from the intrauterine device known as the couples. So the menorrhagia is a T-shaped device which contains small amounts of progesterone, and that small amount of progesterone can be very beneficial. It actually can make your period very light, or in some people, they don't tend to have any periods after 3 to 6 months. Let's say you don't want the Meronacol or it's contraindicated, what other treatments are available? So there are certain medications such as tranexamic acid, which basically helps to reduce the breakdown of clots within the womb, and that can help reduce your bleeding by approximately 50%. Other medications include non-steroidal anti-inflammatory drugs such as mefenamic acid, which not only can reduce your bleeding by approximately 25%, but also can help with painful periods. Let's say those medication hasn't worked, what other options are there? Other options include contraception, so the combined oral contraception, or the progesterone only injection or implants can be used to control heavy bleeding as well. So let's say you're having heavy bleeding and you've got all this information and you're waiting to see your doctor. What can you do? First thing, as I mentioned, is making sure that you keep a diary. Keeping a diary of how many pads or tampons you're using, whether they're partially or completely soaked, and if they contain any clots. Second thing is making sure that you keep a list of all the medication and over-the-counter drugs or herbal remedies that you might be taking. As I mentioned, certain medication can increase the risk of having heavy bleeding. If your period are also painful, you can also use things like heating pads, and you can also try certain medications such as ibuprofen if it's something you can use. And also making sure that you're not taking too much of it, because that can also cause certain health problems as well. So thank you so much for watching my video. I really hope you guys have enjoyed it. If you have, please make sure you drop the video a like, make sure you subscribe, and I will see you guys in my next video. Take care. Bye.